Laminitis, a debilitating condition affecting horses and ponies, is a critical concern for equine health. It involves inflammation of the sensitive laminae, which are tissues that bond the pedal bone to the hoof wall within the horse's foot. This inflammation causes excruciating pain and can lead to serious complications, including chronic lameness and even euthanasia in severe cases. Understanding the causes, stages, and treatment options for laminitis is crucial for horse owners and professionals alike, as early intervention and proactive management are paramount in mitigating the devastating effects of this disease. Laminitis can arise from various factors, often acting in concert to trigger this complex and painful condition in horses. Understanding these causes is crucial for prevention and effective management. Some of the most common causes include metabolic conditions like equine metabolic syndrome, EMS, and Cushing's disease, PPID, disrupt hormone balance, predisposing horses to laminitis. These conditions are often linked to insulin resistance, which can be a significant risk factor. Insulin resistance highlights the importance of weight management and controlled sugar intake. Proper diet and regular exercise are essential in managing these metabolic disorders. Feeding excessive amounts of grain or lush pasture grass, particularly to susceptible animals, can cause a rapid release of sugars into the bloodstream. This sudden influx can be detrimental. This overload can overwhelm the digestive system and trigger a cascade of events leading to laminitis. Monitoring and adjusting the diet is key to preventing such issues. Systemic illnesses like colic, retained placenta, and certain medications can also increase the risk of laminitis. These conditions often require immediate veterinary attention. These situations often involve inflammation or reduced blood flow to the hooves, compromising laminar health. Early detection and treatment are vital to prevent long-term damage. Recognizing the stages of laminitis is vital for effective treatment and management. Early identification can make a significant difference in the outcome for the horse. The severity and clinical signs can vary, but understanding the progressive nature of this disease is essential. Laminitis can start subtly, with minor signs that are easy to overlook. This initial phase often goes unnoticed, as clinical signs are subtle. Small changes in behavior or movement can be the first indicators. However, changes are already occurring within the hoof, making early detection through regular farriery care crucial. Regular checkups by a farrier or vet can catch these early signs. As the condition progresses, this stage presents with obvious lameness, heat in the hooves, and a strong digital pulse. These signs indicate that the disease is advancing. Horses exhibit reluctance to move and often adopt a characteristic sawhorse stance to alleviate pain. This stance helps them shift weight off the affected hooves. Occurring within the first 48 hours, this stage may show improvement or a plateau in clinical signs. Early intervention can sometimes halt the progression. However, internal damage may be ongoing, underscoring the need for continued intensive care. Regular monitoring and treatment adjustments are crucial during this period. If not effectively managed in earlier stages, laminitis can become chronic, leading to permanent changes in hoof structure. Chronic laminitis can severely impact the horse's quality of life. This can result in recurring lameness, hoof rotation, and even sinking of the pedal bone. Long-term management strategies are essential to prevent further deterioration. Farriers play a critical role in managing laminitis, providing therapeutic hoof care to alleviate pain and support healing. Their expertise is essential throughout the course of the disease. Careful trimming by a skilled farrier helps realign the hoof capsule, reducing strain on the inflamed laminae. This involves removing excess hoof wall and creating a support system to redistribute weight bearing. Specialized shoes, such as heart bar shoes or Stewart clogs, may be applied to provide additional support and protection to the compromised hoof. The choice of shoe depends on the severity and stage of laminitis. Section 5. Heart bar shoes versus Stewart clogs, weighing the options. In this section, we will delve into the pros and cons of these two therapeutic shoeing options for horses suffering from laminitis. Both heart bar shoes and Stewart clogs offer therapeutic benefits for laminitic horses, but their suitability depends on the specific case. Each option has its own set of advantages and potential drawbacks that must be carefully considered. Heart bar shoes. These shoes feature a wide, heart-shaped bar across the frog, aiming to transfer weight from the hoof wall to the frog and sole. This design helps in redistributing pressure and providing relief to the affected areas. While offering some support, heart bar shoes can be challenging to fit correctly and may not be suitable for all stages of laminitis. Proper fitting is crucial to ensure the shoe provides the intended therapeutic benefits without causing additional discomfort. Steward clogs. Considered the gold standard for acute laminitis, steward clogs provide maximum support and pain relief. They are designed to offer immediate relief and are often used in the initial stages of treatment. These temporary shoes elevate the hoof, reducing tension on the lamini, and offer a cushioned surface to promote healing. The elevation helps in minimizing the strain on the affected tissues, allowing for a more comfortable recovery process. Section 6. Veterinary intervention, systemic management, and support. Veterinarians play a crucial role in diagnosing, managing systemic factors, and supporting farriers in the overall care plan for laminitic horses. Diagnosis and pain management. Veterinarians confirm the diagnosis, assess the severity, and provide immediate pain relief through medications like non-steroidal anti-inflammatory drugs or NSAIDs or other analgesics. Addressing underlying causes. Identifying and treating underlying conditions, such as EMS or Cushing's disease, is vital. This often involves dietary modifications, medication, and long-term management strategies. Monitoring and collaboration. Regular veterinary monitoring is essential to assess the horse's progress, adjust treatment plans, and ensure effective communication and collaboration with the farrier. Section 7. Owner responsibility, diet and paddock management. Owners play a vital role in preventing and managing laminitis through responsible horsekeeping practices. Dietary control. Providing a balanced diet low in sugar and starch is crucial, especially for horses prone to laminitis. This may involve limiting pasture access, choosing low-sugar hay, and avoiding grain. Weight management. Maintaining a healthy weight is essential, as obesity significantly increases the risk of laminitis. Regular exercise and careful monitoring of body condition are key. Hoof care scheduling. Regular farrier appointments for hoof trimming and shoeing is essential, even for horses without laminitis. Early detection of hoof imbalances can prevent problems from escalating. Section 8. Prevention, the best medicine. Preventing laminitis is always preferable to treating it. Implementing proactive measures can significantly reduce the risk for horses. Risk assessment is key. Identifying horses at higher risk, such as those with EMS, Cushing's disease, or a history of laminitis, allows for tailored management strategies. Gradual dietary changes are also crucial. Sudden changes in diet can disrupt the delicate balance of the digestive system, potentially triggering laminitis. Gradual introductions of new feeds are essential. Careful pasture management is another important factor. Limiting access to lush pasture, especially during spring and fall when sugar content is high, is essential for at-risk horses. Section 9. Working in harmony, the veterinarian-farrier partnership. Effective laminitis management requires a collaborative approach between veterinarians and farriers. Open communication and shared knowledge are paramount. Information sharing is crucial. Regular communication about the horse's history, clinical signs, and treatment plan ensures everyone is informed and working towards the same goals. Joint assessments are also important. Veterinarians and farriers should ideally assess the horse together, allowing for a comprehensive understanding of the situation and facilitating coordinated care. Respect for expertise is fundamental. Both professions bring unique skills and knowledge to the table. Respecting each other's expertise and working collaboratively leads to the best possible outcome for the horse. Section 10. Early intervention. Key to successful outcomes. Early detection and intervention are crucial in managing laminitis and improving the chances of a positive outcome. Recognizing subtle signs is very important. Owners and handlers must be vigilant in observing their horses for any signs of lameness, hoof sensitivity, or changes in gait. Prompt veterinary attention is also necessary. Any suspicion of laminitis warrants immediate veterinary attention. Early diagnosis and treatment significantly improve the prognosis. Proactive management is essential. Implementing preventive measures, especially for at-risk horses, can help avoid the devastating consequences of this debilitating disease. Section 11. Conclusion. A collaborative approach to laminitis. Laminitis is a complex and challenging condition that requires a multifaceted approach to management. By understanding the causes, stages, and treatment options, horse owners and professionals can work together to minimize the impact of this debilitating disease. The symbiotic relationship between veterinarians and farriers, along with responsible horsekeeping practices, is essential for early intervention, effective treatment, and ultimately improving the well-being of horses affected by laminitis.